Good evening. This is Bisi Ademoyiwa again. I'm a breast medical oncologist and I take care of women who have breast cancer. This is the sixth in my series of videos talking about breast cancer, and the goal of these videos really is to educate the lay public. Again, none of these videos is designed to take the place of the patient-physician relationship. So if you have breast cancer or you have any medical concern, please make sure you follow up with appropriate medical attention. So today I have a very good friend here, an esteemed breast surgeon. Her name is Dr. Jovita Oruwari, and I'm going to be interviewing her, and she's going to tell me what she does and talk a little bit about breast cancer. So just to start, Jovita, what is breast cancer? How do you explain, the diagnosis to a new patient who comes into your office for consultation?
Okay. First of all, thanks for having me be part of your series.
Such a pleasure.
Which is a great series. It's always a good thing to educate people out there about this diagnosis, because it's such a scary thing. So initially, when I see a patient to talk about breast cancer, a lot of people have a concept of what cancer is in general, and we know what cancer is medically and biologically. But what I tell people in lay terms is that breast cancer is when normal cells, for various reasons, become abnormal. So those cells grow out of the normal controls that normal cells have. So they grow rapidly and then take over the normal cells and then eventually lead to this disease that can eventually kill someone. So that's kind of the bottom line of what it is.
Okay. Yeah. Okay. And then, is breast surgery necessary? Because, many people are scared about being cut on, and, there's this misconception in the community that if you cut, open a cancer, it kind of spreads all over. And so people ask me, is there a way that they can forego breast surgery for breast cancer? Is it necessary? What impact does it have on a breast cancer patient?
Yes, breast surgery is very, very necessary. I'm not just saying that because I'm a breast surgeon, but it is necessary. First of all, we have to remove the abnormal cells. So for that part, it is necessary. And that whole concept of when you cut into something and it opens the air, then it spreads all over, it's been proven over and over to be false. That does not happen. Okay. If it happens, we would not be doing it. I mean, as doctors, we first do no harm.
Absolutely.
So we wouldn't want to do anything that would harm someone. So yes, surgery is necessary to remove the cancer.
And what actually happens? So when you tell a patient that you're going to have surgery, breast surgery for cancer, what actually happens? In terms of technicalities, okay. What are the options? How is it done?
Okay, so when someone has a breast cancer, there are two main options that I talk about in terms of surgery. We can do what's called a lumpectomy, and that just means removing the cancer and the tissue surrounding the cancer without removing the entire breast.
Okay, so they still have a breast.
So they still have a breast. We're just removing the lump and tissue around it. And when we do that, then radiation has to be added to decrease the chances of the cancer coming back. And radiation is a whole other issue. And then the second option in terms of surgery is a mastectomy, meaning that we're removing the entire breast. Okay. And when we do that, typically radiation is not needed. And it's been shown over and over the years that doing the lumpectomy, so long as we add the radiation, is equivalent to removing the whole breast. There are patients that's not true for, but for the main, okay. that's surgery.
Okay. And then, so what does a woman go through when she has either a lumpectomy? How soon is the recovery? What are the complications like? Or a mastectomy? What does a woman go through? And what are the recovery? I guess what is the recovery
Sure.
like for both kinds of surgery?
So a lumpectomy is it's outpatient surgery. So that's the least of the surgeries. All we do is make an incision where the cancer is, remove the lump, and then all the stitching is inside, so the stitches dissolve.
Okay.
It heals up nicely. A lot of times it's a 30-40 minute long surgery.
Oh, that quick?
Yeah, they go home the same day, and you're able to a lot of times shower the next day and get back to usual. Recovery, I tell women, is just a few days to a week for
Okay.
doing a lumpectomy. You know, with the lumpectomy, depending on the type of cancer, if it's an invasive cancer, for instance, a lot of times we do surgery to remove lymph nodes under the armpit.
Okay.
So that's a separate incision under the arm, but still, that recovery is about within a week. So that's pretty easy. If we did a mastectomy, because that's much bigger surgery, it's a surgery that can be anywhere from 2 hours to 5-6 hours if we're reconstructing the breast. And we typically will keep a woman overnight for that surgery. And when they go home, they have drain tubes in that they have to deal with. And that recovery, I tell people, is anywhere from 2 weeks to 6 weeks. And it's not 2 to 6 weeks of being laid up in bed and not being able to do anything. You're gonna be up, you're gonna be walking around. There'll be, of course, some pain because it's surgery, but because it's not the radical surgeries they used to do years ago, we're not removing muscles.
Okay.
The recovery is really not as bad as, even with reconstruction, which again is a whole other issue, the recovery is really pretty good.
Okay. And I find a lot of people are scared to do surgery because I've had women tell me that if they remove the breast, then the whole femininity is gone. They feel like an amputee. They're very, very scared, and some of them actually don't even come back just because of this fear. So how do you deal with fear of surgery and the whole issue about how a woman will feel if she loses her breast due to cancer?
Okay. So there's two issues that I try to address to patients when it comes to fear. The one is fear of losing part of your womanhood,
Right.
part of your femininity, and that's a tough thing, and that's something we try to talk through, and they try to talk through, and we have psychologists and therapists that we can help to deal with that. But something that helps with that is that we have breast reconstruction options to help reconstruct the breast or rebuild the breast so that they feel less of that loss. It's not functionally going to be like a normal breast, but visually it will look like a normal breast. So that helps a lot of women doing that reconstruction. And in terms of fear, the other thing that a lot of women are concerned with is, am I going to die
Right,
having
right.
this breast cancer? And that's something that we've really dealt with a lot with all the treatments we have for breast cancer today over the years. So breast cancer does not have to be a death sentence like it used to be years ago. It's very treatable, and the key really is being able to diagnose it early, and that's why we encourage women to make sure you go in, get yourself examined, get those mammograms, check yourself. All those things help to pick up and diagnose this early, because the earlier we can find it, and the more curable that it is. Yeah, so that's a really important thing. Those are good questions, actually. Those two aspects of fear is what we try to talk about a lot.
Do you think there's more awareness in the community? Are people being diagnosed with breast cancer? Are you seeing more breast cancers versus, years ago? Or is it that there's just more awareness? What do you think is going on? Because, a lot of people have been asking, is the incidence going up?
Right.
What is going on?
Right, I get asked that a lot, and as you know, with all the statistics and data that we have, it's not necessarily that the incidence is going up. I really think it's the awareness. There's just so much awareness out there. On the news all the time, we have October Breast Cancer Month, and so many people talk about it where they didn't used to talk about this years ago.
It was a taboo.
It was a taboo, right? And today it's not so much that. So I think that awareness is allowing people, even younger women especially, to be aware of their breasts, to examine their breasts, to keep track of what's going on. So I'm seeing younger women come in, and of course we're diagnosing more younger women, I think, because we're just overall more aware. And the whole genetics of breast cancer, that's also made it, yeah.
So, again, you've heard Dr. Oruwari talk a little bit about breast cancer, and I think the bottom line is that, breast cancer is curable if diagnosed early.
Yes, it is.
Surgery doesn't necessarily mean that one loses one's womanhood. If caught early, a woman can be treated appropriately, surgery, other medical treatments, and really can continue to live a very fruitful and long life. So thank you so much for coming. I really, really appreciate it.
Thank
I
you
know we've
for
been
having
planning
me.
this for many, many months
I
now.
know.
And again, if you have any concern in your breasts, or you need to talk to somebody about what's going on, make sure you follow up with medical attention again, because breast cancer is fully curable if diagnosed early. Thank you so much for listening.
Thank you.